It really is a pretty amazing place, and as part of our KSAT Q&A today, KSAT reporter Jonathan Cotto joining us to talk more about BAMC. Jonathan, I've been at BAMC before. It's not some place where you can just drive up to. It's not like your average hospital. So I want people to realize just how rare a look like you got inside the walls of that place is.
You know, it was a process that we had to plan out for several months. So I do have to thank the team of professionals there that coordinated this visit. BAMC is treated like any other military installation, so you do have to have the proper credentials to get inside.
And now we talk a lot here about, people who were involved in serious car accidents, in some of those violent crimes that we heard that surgeon mention. They end up at BAMC. So that's what makes this so unique, that it's, while treated like a military installation, it serves the entire community. So how did that happen?
You know, we're in a unique position, and we cannot take the effort that the medical professionals at BAMC do day in and day out. So if you ever have an opportunity to drive by the facility, wave and say thank you very much for everything that they do. But, when you put things into perspective, when we're seeing this crime increase in the city, it's only obvious to expect that those number of crimes are going to be reflected in an emergency room as well.
Yeah. Now, part of what they use out there is whole blood, and that's a little unique, is it not, for a lot of trauma centers?
It is actually. BAMC relies on its own whole blood supply, so even the helicopter is equipped with its own, whole blood supply, and ambulances now as well. And this is something that came about through all the knowledge and experience that's been developed overseas in Iraq and Afghanistan, when they're treating the troops that are experiencing these injuries, these trauma injuries, traumatic experiences. They've learned that using whole blood is the most effective method when trying to treat a trauma patient.
And whole blood, that is blood that has not gone through the process of having platelets removed, white blood cells, things like that.
Correct. So the whole blood does have the red blood cells, the platelets, and the white blood cells. And it's important to note that this has changed within the last 25 years. In my conversation with, Chief of Trauma, Timothy Nunez, he says that in the 90s, they would use a crystalloid solution. So the technology and the advances have really come a long way.
Yeah.
And just the jewel that Joint Base San Antonio is, but then when you put BAMC and the San Antonio military medical community together, there are not a lot of communities, if any, that are like San Antonio's.
Steve, I was really impressed to learn that we are in a unique position to have BAMC. We are very lucky to have a facility of this type because, as you heard, not even Walter Reed, who is a state-of-the-art medical facility as well, has the capabilities or serves in the capability that BAMC does, serving both the military and the civilian. Very unique.
Big part of the community.
How did it get this level 1 trauma designation? I know that's something you and I were talking about earlier today.
Yes, level 1 trauma designation is something that not all hospitals get. It's very difficult to obtain and maintain. So this happened about 30 years ago when the state of Texas decided that they wanted to expand their trauma system. And the city of San Antonio says, hey, we have to be part of this trauma system as well. So BAMC became a level 1 trauma center, as well as University Hospital and as well as Wolford Hall, that many may remember.
Yeah.
So over the years, and this was 96 and 97, so over a span of 2 years, those 3 centers received their level 1 designation, BAMC becoming the 7th in the state to have that designation. Now there's roughly about 20 hospitals across the state with level 1 trauma.
Jonathan Cotto, appreciate your reporting and your Q&Aing with us.
Yes,
First
absolutely.
time being asked the question.
An in-house Q&A.
Yeah.
All right, Jonathan, thank you.
Thank you.
Keep up to date with all of San Antonio's top news, weather, and so much more by clicking the like and subscribe buttons below. And once again, thanks for watching KSAT.